A placebo is, as we call, a sugar pill or sugar water, so there is no drug in a placebo. It would be unethical for us to give a patient a placebo in a clinical trial when they have active disease. The clinical trials that we have mainly here at the Virginia G. Piper Cancer Center are phase 1 in nature. So we are one of the 2 or 3 clinical sites that have the clinical trial. It's a population of 30 to 40 people, and we are enrolling individuals who have active disease that didn't respond to initial therapy, so we would not administer a placebo. A placebo would come into play in a clinical trial potentially when, like in a phase 3 type of clinical trial, when we are comparing the investigational drug against the standard of care. For some types of cancer, like the very rare type of cancers, there is no standard of care. So we would administer the investigational drug versus the standard of care, which in some situations may be a placebo because we don't have anything to compare it against. In that situation, that's where a placebo would be. But remember, again, you're in a clinical trial, so you're going to be monitored very closely. So let's say you're in this phase 3 clinical trial, and a lot of times you don't know what you're getting, if you're getting the drug or the placebo, but because you're in a clinical trial, you're watched so closely, as soon as that disease advances, we will know right away, and we would take you off the trial, and obviously appropriate treatment would be provided at that time.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.